Eric Slisher.
Hi, my name is Eric Slisher. I'm a resident in Parma, and I'm a licensed therapist working in Jackson County. I'm here to express my full support of Daniel Mahoney's resolution to make racism a public health crisis. In his book, How to Be Anti-Racist, Ibram Kendi proposes the definition of racist: one who is supporting a racist policy through their action or inaction or expressing a racist idea. The definition of anti-racist is one who is supporting an anti-racist policy through their actions or expressing an anti-racist idea. A racist policy is any measure that produces or sustains racial inequity between racial groups. If the County Commission does not support Daniel Mahoney's resolution, it is in and of itself perpetuating racism. Thank you. I yield my time.
Nancy Smith.
Hi, I'm Nancy Smith. I live in Liberty Township, 5th District. I'm a retiring public school teacher, and I'm a candidate. Also, I'm a candidate for state rep for District 65. First, I want to thank the folks that have reminded us that this is a moment for listening. I'm in total agreement with that because it might seem like some of us are pontificating rather than listening right now, but I'm proud of my community for all showing up tonight and for doing so much listening. Racism, systemic and structural racism is an American historical fact, and it is a crisis. Decades of inequity in healthcare, employment, housing, and education have come into sharp focus in light of the COVID-19 pandemic. These structural inequities have manifested in disproportionate rates of infection, hospitalization, and deaths for people of color. And the murder of George Floyd really just served to ignite the pent-up anger across our nation. Clearly, we are in a moment of reckoning. Turning away is not a choice. Doing nothing is not a choice. Even commissioners, even if you perceive that your particular district of this county is mostly white, it's still not a choice. To quote James Baldwin, not everything that is faced can be changed, but nothing can be changed until it is faced. You are the elected leaders of our county. I'm asking you to face this moment. What will you do to redress the harm of systemic racism in Jackson County? I urge support of Commissioner Mahoney's resolution as written to declare racism a public health crisis and to create a committee to work toward racial equity. Thank you.
Elizabeth Spots.
Hi, I'm Elizabeth Spots. I'm a resident of Grass Lake, Michigan, in the 2nd District. The resolution brought by Daniel Mahoney is really the bare minimum for what we need to do to fight back against racism. Racism is unquestionably a public health crisis. People of color, most specifically Black people, have been consistently killed and harmed due to racism. This comes from the police, the medical field, schools, and the mental health field, of which I am a member. I also want to thank Sherry Butters for sharing those statistics earlier of how Jackson specifically is being affected by systemic racism. In my 9 years as a social worker, I have seen racism wreak havoc through all of these systems and cause lifelong trauma. As Martin Luther King Jr. stated, the great stumbling block toward freedom is not the white citizens counselor or the Ku Klux Klaner, but the white moderate who is more devoted to order than to justice, who prefers a negative peace, which is the absence of tension, to a positive peace, which is the presence of justice. It isn't enough to just state the obvious of racism being a public health crisis. We must also take steps forward to fight back against racism. We must be anti-racist. We must have steps to take to make a change and address systemic racism in the way that it needs to be addressed. The committee being proposed is a step in the right direction. I ask that the commissioners all vote to pass the resolution brought by Dan Mahoney and begin the work to fight systemic racism in Jackson. Thank you.
Bethany Stutzman.
Hi, my name is Bethany Stutzman. Can you turn my camera on?
No, we cannot.
Okay. I'll start with, I'm not understanding why we can't all be seen, because I think that puts all of us at a disadvantage, that you can't see us and experience the full emotion of what we're trying to convey to you all today. But my name is Bethany Stutzman. I've lived in Jackson for over 20 years. I've lived in the Northwest School District, and now I live in the city. I have worked for the United Way for over 15 years at this point, and I am in full support of Commissioner Mahoney's resolution to declare racism a public health crisis. And I think the statistics are well documented, so I'm not going to focus a lot of time on that. I guess I want to share more of my personal story over the last 5 years or so. As someone who has a master's degree in social work, a bachelor's degree in communications, and has worked in this field for a long time, I'm embarrassed to say that it took me so long to start understanding the crisis in our country as it relates to racism. My own personal bias, as unintentional as it has been, 5 or 6 years ago, we really started having a lot of conversations in nonprofit circles, and I started listening to Black and Brown colleagues who experience racism on a regular basis. And frankly, I was shocked. I literally had no idea the extent of what they experience to this day. And, since then I've been on a journey of reading a lot of books, of going to conferences and listening to a lot of people. And I can tell you one thing, that in all that I've learned in the last 5 or 6 years, and, I take full responsibility for the fact that my eyes were shut to this for so long. And I'm doing what I can now to correct that and get on the right path. But there is no way that I could adequately be on a planning team to make recommendations about racial equity policies and what those should be. And I just want to strongly encourage you to make sure when this committee is formed that you include people who have experienced racial inequity, and that they be the majority of that committee, because they truly are the only ones that can speak to what they've experienced and provide appropriate recommendations for what we can do to address the issue. Thank you.